Hi, everybody. Welcome to our first ever virtual event with buybuy BABY, Feeding 101. I'm Kelly with buybuy BABY, and we're so thrilled to have you guys here with us as we dive into the world of feeding. Today's event is all about empowering you with knowledge and support, and we're incredibly excited to be joined by the amazing Katie Clark, better known as the Breastfeeding Mama. Just a little bit about Katie, and then I'll hand it over. Katie is an international board certified lactation consultant with additional certifications as a breastfeeding specialist and lactation educator. She has extensive training in lactation, oral restrictions, clogged ducts, and mastitis, and favors holistic approaches that focus on both mother and baby. Since becoming an international board certified lactation consultant in 2023, she's supported breastfeeding families since 2015 and manages a robust online community with tens of thousands of members. Please help me give Katie a warm virtual welcome. We'll turn it over to you, Katie.
Wonderful. Thank you so much. I'm so excited to be here today. One of my biggest passions is helping new moms learn how to breastfeed in whatever way that works for them. Because one thing I have found over the years is that it never looks the same for everyone, for anyone. And it's so important to realize that your journey is going to look different from your friends and your sisters and your best friend and your people online. And the sooner that you embrace that, the more peace I feel like you can find with your feeding journey. And this session is all about feeding and not necessarily just breastfeeding directly from the breast. And that's one thing that I think a lot of people don't realize is that lactation consultants, IBCLCs, are uniquely equipped to help you with any of your feeding issues or helping you with feeding in any regards. And so, yes, I definitely help with that first latch and helping you to improve your milk supply and learn how to feed directly from the breast. But I also love helping with pumping and with bottle feeding, combo feeding in any regards. Because in my experience, most families do a combination of a variety of things, and there's no right or wrong way to do that. And so if you run into an issue with a baby where they are refusing a bottle, that is something that I love to help with because it can be super stressful to have a baby refuse the breast and also to help them refuse the bottle. And just looking here, it looks like we have some babies that, some moms that are still pregnant and babies that have just been born. And so I definitely want to gear this towards you. So if you have a specific topic you want me to talk about in regards to breastfeeding or pumping or bottle feeding, drop that in the comments. We'll definitely have a Q&A at the end, but I want to make sure that this is geared towards you. First off, I think that the most important thing, if you're still pregnant, that you can do to prepare to have a successful breastfeeding journey is to prepare. I have people come to me all the time asking me, what can I do to make sure that I breastfeed successfully? And, there's no secret solution to that. But I do find that the moms that do prenatal consults and that do prenatal education have more confidence in the long run, even though that may not guarantee that you have no problems. Most people don't have a problem-free breastfeeding journey. It's going to help you to feel far more empowered and prepared when those issues come up. Because I don't know if those of you that are pregnant still, and I'll definitely jump into things that are going to be relevant to you, those of you that have already had your babies. But I don't know how many of you are giving birth in a hospital, but that is a topic that I really passionate about because hospitals are great, but they are often not equipped to help you successfully initiate breastfeeding beyond, having you put the baby on your chest and maybe latching the baby. And so a lot of times you're left on your own when you give birth because there's just not a lot of resources, and that's not the top priority. And most, RNs that are in the hospital are great and will do the best that they can. But I find a lot of issues start in the hospital because a lot of times you aren't sure how to latch that baby and or know how often to latch, or if you're doing it too much or too little, or what signs to look for. Or you might run into your baby losing weight quickly and not knowing how to navigate that. And so understanding some of those topics before you give birth can make a huge difference. And making contact with a lactation consultant that you trust and that you feel is going to be able to support you while you're in the hospital and when you come home can make a huge difference. And so one of the biggest things that I love to recommend is, barring any complications after you give birth, is to do skin to skin. That is definitely a big practice now. It used to, even my oldest is 12 years old. And even back then, 12 years ago, they weren't as big on skin to skin as they are now. And I just remember that they took him from me and he was perfectly healthy. They just took him. I didn't even see him. They weighed him, they wrapped him up and brought him to me about 15 minutes later. And I didn't have that skin to skin, and, everything went fine. If you don't get that golden hour, which is what they talked about, doesn't mean that you're not going to have a successful breastfeeding journey, but I do find that it gives you a really good start if you're able to do skin to skin during that first hour. And during that first hour, I always recommend putting the baby directly to your chest, skin to skin. And if your baby is awake and alert, they may try and self-attach themselves. They may not, that's okay. But try and latch within that first hour. And it may not be the most perfect latch ever. It might be amazing and magical, but it may be not awesome. Baby may be tired depending on, if you had an epidural, if the labor was particularly arduous, things like that. But doing that skin to skin latching, and then after your baby latches, hand expressing for, a little bit just after you nurse, and giving your baby that little bit that you might hand express in a spoon or in a syringe. Research has shown that doing this within the first hour, they don't find that after the first hour this is as beneficial, but doing this in the first hour might have a positive impact on your milk supply at 6 weeks, which is super awesome, because I know many new moms are concerned about their milk supply and want to do everything they can to improve their milk supply. And that is one of the things that you can do in that first hour. And I recommend that for all moms, but especially if you are at a higher risk of things like low milk supply. So if you have insufficient glandular tissue, if you have certain underlying health conditions such as diabetes, or sometimes we see with like PCOS or thyroid issues, there's a variety of different things that can be linked to low milk supply. And it's just so important to optimize that as much as possible in those early weeks. I often will use this example that my friend, Shelly, if you have any twins, she's Twin Mom Guide and she has great resources, but she gave me this awesome analogy about the first 6 weeks is basically that is the time for you to be lighting up your milk supply. And so it's kind of like a Christmas tree where you can light up all the lights that you can. And so that's basically the hormone receptors that help to, are called prolactin receptors, that help with your milk supply and help to establish it. And so those first 6 weeks, you can put up as many Christmas lights as you can. And some of this is going to be dependent on your glandular tissue and how much of it has been developed. But during those first 6 weeks, it's really important to frequently empty the breast, because that establishes those prolactin receptors. After that 6 weeks, 6 weeks roughly, you pretty much have all of the Christmas lights or the prolactin receptors that you're going to have for that breastfeeding journey. So after that point, if your supply drops, you should be able to bring it back up to where you have established it, but it's going to be hard to establish more prolactin receptors after those first 6 weeks. So even when you have lower glandular tissue, it's really important to just frequently empty the breast as much as you can, because that is going to help to establish your supply during those first 6 weeks. Let's see, I'm already seeing some stuff come in. So my baby was born with a tongue tie. Tongue ties are definitely a hot topic. It's something I feel very passionate about, oral restrictions in general, and tension and things like that, because I do see on a very, very regular basis that they can cause major issues. But it's important to have the right support. So while pediatricians suggest just keep monitoring at this point, my lactation consultant told me she was not latching well. She got frustrated when she's on my chest. She suggested I do pumping and bottle feeding. It's been 2 weeks as of now. I wanted to try breastfeeding again and see if she's getting better at latching. What are your thoughts and how I should go about that? It's such a tricky situation, and without knowing your entire situation, I can't give like specific advice, but I will say go with your gut, and there is nothing wrong with trying to latch your baby. One of my favorite things to say is that breastfeeding is a vital sign. And if it's not happening, there's a reason for that. Babies don't just breastfeed or just don't not breastfeed because they don't want to or because that's just how it is. If a baby's not breastfeeding, there's a reason. So if your baby was not latching well, it could have been a series of things. It could be positioning, it could be tension in their body. It could be a tongue tie that is preventing them from latching efficiently. And so I don't necessarily agree with the idea that you had to go straight to like pumping and bottle feeding. I would say sometimes that's what we do in the interim as we fix the issues. And so I would definitely have that conversation with your doctor where you say the baby's not latching and they should be. And so what's the reason for that? That's always the thing that I will tell families is to say, if someone, especially if someone's dismissive of things like tongue ties, if the tongue tie is not the issue, then what is the issue? Because a baby that's not breastfeeding, there's a reason behind that. And so I would say do skin to skin. If baby latch, go ahead and latch. I would work with your lactation consultant, and if that one is not giving you the results you want, reach out to another one and see if they can help you. Because I think that there's always reasons and it's important to get to the root cause. And that's a huge part of what I do in my practice. And I do, I'm in Denver. I don't know where all of you are. It looks like, I don't think in Denver, but I also do virtual virtual consults worldwide as well. And so it's just important to get to that root cause. But I would say if you want to try to latch, you should totally do that. So I'll come back to the milk supply in a second. Do you have recommendations for pacifiers and bottles specifically for breastfed babies? This is a great question. I sources on this. If you go to my Instagram page, I have from a few months ago where I talk about different bottles and I have a bottle guide. And these are not necessarily just the best bottles for breastfed babies, but I think the best bottles for babies in general. And one thing to keep in mind is that pretty much every bottle out there is going to tell you it's the best for breastfed babies. And the more the bottle is said to look like a breast, the less likely it is to be a really great bottle. I will say that I will show you real quick the type of nipple that I really like for bottles. Just kind of the shape that we're going to go for. And I love this gradual slope. So you want a gradual slope rather than like let me get the other one that I would show you a example of what I'm talking about. This type of nipple we generally don't want to go for because it's very difficult for your baby to get a good latch. A lot of times they're going to just hang on to this nipple and it'll be like strike. And so some babies will take this bottle, like this type of nipple, just fine, and they'll go back and forth great. But a lot of times it's going to be difficult. And so this is always my go-to. There's a lot of different brands out there. But this is one that I really like. This is Latching. I find that their flow is a little bit fast. So their sister brand is Pigeon and they have a slower flow. And I always start with this one. And sometimes if your baby's refusing the bottle, it's not up until 6 months, they really do not have the ability to refuse the bottle just because they want the breast instead. It's because they literally are not able to use that bottle. And we have to figure out where in the process that they're not able to. So sometimes there's different bottles that will work better because of a baby like tucking their chin or they have jaw asymmetry. But in general, I really like the Pigeon bottle. I like Latching. I like Ebb and Flow Balance simply because they have this gradual slope, because that's really what we're going to look for, because this is going to hit the roof of the palate of the mouth easily, and that's especially important in pacifiers. And it's going to have a deep latch and have a latch more similar to at the breast. Let's see. I'll stop to, yeah. So my Instagram's on there, so definitely go follow along on there. I would love to see you on there. Back to planning eat or drink to actively do while being pregnant. This is a great question. So many people want to know what they can do when they're pregnant for their milk supply. And I will tell you 100% the best thing to do is to have a prenatal consult or to take a class that's specific in milk supply. I do have a class where I do talk about like red flags for milk supply, because really, you can't do anything while you're pregnant to increase your supply besides educate yourself and preemptively get ready for any issues you might have. So during a prenatal consult, you can identify any underlying health conditions that you have. We really do deep dives into like your breast anatomy to talk about, your breast growth during pregnancy or during puberty, because the foundations for breastfeeding actually begin at puberty and every time that you have a menstrual cycle, because that is producing glandular tissue, and then that ramps up during pregnancy. And so during pregnancy, identifying any issues you might have are really, really valuable, because like I mentioned earlier, if the earlier we identify those, the quicker we are going to be able to help you kind of come up with a plan, but also to reassess your goals and your plans for breastfeeding and help you to kind of go through that process. And so even if you don't have any underlying conditions, learning about how milk supply works, what you can do in the beginning, which, skin to skin, frequently emptying the breast, knowing signs that your baby is getting enough, because you may have all the stuff in place to have milk, like a good milk supply. And then something happens and your baby's not transferring milk well, and your milk supply is not going to get established and it may drop. So knowing signs that your baby's getting enough is really, really valuable. And I would definitely say working with a lactation consultant after your baby's born. And there's secondary and primary milk supply issues. And so primary milk supply issues are usually related to like a hormonal or medical condition, something that's kind of beyond your control. So it's even things after birth, like if you have retained placenta, that's going to decrease your milk supply. Secondary issues are to transfers, transferring well. Maybe you're not emptying your breast as frequently as you should, or that you don't know, because there's a lot of information out there on how often to nurse or breastfeed. And there's a lot of influencers on Instagram and TikTok that'll be like, I breastfeed 4 times a day and I never nurse at night and I make 100 ounces a day. And that is not realistic for the most part. So, and sometimes that does happen, but you have to kind of start at the averages of emptying your breast 8 to 12 times a day in 24 hours. But if you have specific questions about milk supply, let me know. And in regards to eating and drinking things, there is no magic food or supplement out there that's going to increase your supply. There are galactagogues and there's herbs and there's foods. And I think that we do have foods that can help us to produce a higher quality milk and to increase milk supply. But that shouldn't be the first stop when it comes to milk supply, because we need to address why milk supply is low or not optimal before we jump into sorry, I lost my train of thought. Before we jump into like adding galactagogues, because I have seen galactagogues being really helpful, and I have a whole list that I will send people that I work with that have like different herbs you can use. But addressing the issue first is really important. And I see people all the time like, oh, how many cookies should I stock up on before I give birth? And they spend hundreds of dollars on cookies. And I just want to say, spend that money on a lactation consultant. And I know I'm a lactation consultant, so it sounds like I'm just like trying to drum up business for myself, but I go to anybody that knows anything about milk supply. Like, it does not have to be me. Invest your money in a lactation consultant, because it's going to save you money in the long run. Or often insurance will cover it. Trying to find the perfect foods and supplements. I will say that I am a huge fan of I'm a big fan of electrolytes, and there's not a lot of research. Breastfeeding just doesn't have research, a ton of research in general, but I find that good quality electrolytes, there's lots of different brands out there, you can even make your own, can be helpful to balance your electrolytes in your system. And some people do find that it helps their milk supply. And so this is just like anecdotal, but it's related to dairy cows, which, not to say you all are dairy cows, but there are similarities between lactation between dairy cows and humans. And so we have a lot of research on dairy cows, more so than breastfeeding. And a lot of farmers will use like salt sticks to help their cows' milk supply. So take that for what it is, but I do think electrolytes can be really helpful. And then also with pacifiers, someone asked about that. I just love those like soothy ones that often they give you in the hospital. Let me grab one just in case you're not familiar with that. So I would say this type is always awesome because it's going to let your baby be able to cup it with their tongue, which is what we want to see. And I also love the Ninico. This one can be tricky for babies that have oral restrictions, and it can take practice, but it is amazing for oral function. So these are great. So those are the two, but these are super cheap and you can find them anywhere. The Ninico is more expensive. Let's see. I exclusively breastfed my baby and have not focused too much on pumping, but I feel like there are times my baby is hungry and my breasts feel empty. She eats every hour, 2.5 to 2 hours. She is 5 weeks old. My baby has had issues with latching as well. We were given nipple shields and I'm having a hard time weaning off them. I'm so sorry. All of those things are so challenging. And it can be very normal for babies to breastfeed every 1.5 to 2 hours. But if you feel, I don't know, it's a thing because some babies thrive on eating every 1.5 to 2 hours and they're gaining weight well and everyone's happy. But if the baby is not latching well, you're using nipple shields, you feel like, I don't know about the weight gain of your baby, but if there's other things going on, I would definitely work with a lactation consultant if you're not already to figure out what's going on. And with the nipple shield, you are definitely still at a great time to wean from a nipple shield. But you really have to address what those latching issues are because a nipple shield is compensation. Which that's not to say there's anything wrong with using it. I definitely recommend nipple shields for varieties of situations, but it means that your baby's not able to latch successfully without it. And so figuring out why you need a nipple shield is going to be really important. And so it's hard to say, like babies come from a place where they knew no hunger. They were constantly nourished. And so they're born and hunger can be a very foreign feeling for them. And so, sometimes they do want to cluster feed. And so cluster feeding is when they feed close together and, every 30 minutes for like 3 hours. That's okay as long as it's not all the time, all day, every day. And if your baby just always seems constantly hungry, I would definitely work with a lactation consultant to see if something else is going on. Let's see what else there is here. So I talked about the pacifier. And so pacifiers can be tricky. You'd want to make sure, one of the things I like to say is point the nipple towards the roof of the mouth and then support the baby's cheeks. Or you can support their chin to help them to take the pacifier. Pediatrician is concerned about baby's weight. She's maintaining her weight but has not gained any weight since birth. Pediatrician recommended giving formula because milk supply is low. When I pump it, get 1.5 to 2 ounces. How can I increase my milk supply to help baby gain weight? Anything I can do? So that's a really complicated situation and I can't it's one of those things where you definitely, if you're not working with a lactation consultant, please find one that works with lactation or that specializes in milk supply and weight gain issues because I think you need support beyond what I can give you here. But I will say weight gain is really tricky. Babies lose weight. And so you really need to look at that weight that the lowest weight that your baby got to after birth. And so if your baby lost 10% of their weight and they are just back to birth weight, then that's one, like, it's going to take a while to get back to that. If your baby has, they were born at 7 pounds, got down to 6'14", and now they're only at 7 pounds at 2 weeks, that's probably a problem. And I would definitely say that we need to address the root cause. And supplementation, it sounds like, is probably necessary, but it's really important with supplementation. And this is for everybody, that when you are supplementing, you really have to be addressing the issues at the same time. So we don't usually just say, okay, let's just throw in a bunch of bottles and see what happens. We need to make sure that you are emptying your breast frequently because the more bottles given and the less time at the breast, the less your supply is going to be if you're not frequently emptying your breast. And so sometimes people will recommend triple feeding. I don't love triple feeding. I find there are better ways that we can empty the breast without making you go crazy because triple feeding is really hard for more than just a couple of days. And triple feeding, for those that aren't familiar, is where you generally breastfeed, pump, and then bottle feed. And it can be crazy to do that. And so increasing your milk supply, make sure that you're frequently emptying the breast. I would say at least minimum 8 times a day, with at least once at night. Make sure that you have the right flange size, which I haven't even talked about flange size, which is something I'm super passionate about because flanges are crazy out there. The largest, most of the time, most pumps come with like a 24 and a 27. And I will say that I have sized one mom with a 24. The average size in my practice is a 15, and it makes a huge difference. And our thoughts on flange sizes have changed a ton over the past couple of years. There's new research there's a lady, her practice called Babies in Common, and she has been spearheading the research on this. And I'm so grateful because I see such better results with moms using a flange size that is more similar in their nipples to their actual nipple diameter. And you have to get these off brand. Usually you have to buy them on Amazon, things like that. But they don't usually come with the breast pumps, but I'm hoping that'll change in the future. But having the right flange size is going to make a huge difference. 1.5 to 2 ounces when you pump is not terrible. That's average that we see is about a quarter ounce to 2 ounces total when you are pumping in like after you nurse. So like if you nurse and then pump like 10 minutes later, if you're pumping in place of a nursing session, we're going to look for about 1 to 1.5 ounces per hour from the last time your baby fed or nursed. So your situation, definitely finding out why baby's not transferring milk well, why your milk supply is low. And then those two things are really important. And so I work with families all the time. I actually have in my, I have a milk supply course where I talk about that, where it's like a self-assessment where you figure out what the issue is, and then you can kind of go from there to increase your supply. Let's see, one breast gives less milk while pumping compared to the other. What might be the problem? There might not be a problem at all. First of all, I would definitely make sure you have the right size flange. You can have a different size flange for each breast. That's not uncommon, but it's also not uncommon to have one side that produces less than the other. Our breasts are not twins. They are sisters or cousins is what a lot of us will say. And that's because they are independent. They have different glandular tissue, different systems. One might produce more than the other. If your baby prefers one side over the other, they might have established the supply more strongly in that side. So usually I will say it's not a huge issue that you're producing more on one side over the other. But some people, they're like, I'm super lopsided. I need to figure this out. And so in that situation, I would prioritize nursing on the side that's more the slacker side. You could also do some power pumping on just that side. Power pumping is where you pump on and off, 10 minutes on, 10 minutes off for an hour. And then, or you can take a 3-hour chunk of time and pump for 10 minutes at the beginning of each hour. So hopefully that answers that question a little bit. Any recommendations on how to increase supply if you have a history of tuberous breast? Baby latches well at 10 days, but have not been able to get a good supply. Yeah, so that's really, really tricky. After you give birth, it's more difficult to increase your glandular tissue. Some people will recommend things like goat true. There are different medications out there, which can be a complicated topic, but there's a lot of things we can do and try. Some people will use SNSs that have tubular breasts. A lot of the things we can talk about are going to be probably more beneficial for like subsequent pregnancies. But it really depends on what the root cause, because tubular breasts usually come, or insufficient glandular tissue, there's different things that people will call this. They come usually because of hormonal issues or different issues like that, or sometimes it might be like damage or something that happened in the womb. And so it's tricky. It's definitely an individualized thing. And I would definitely, you're welcome to reach out to me if you want to dive more into that, or find somebody else that is skilled in lactation or in low supply to kind of address what would be the best situation for you. Okay, can you repeat? Let's see. Oh, I'm so glad you're finding it helpful. Please, if you have questions, I am happy to answer them. And again, I can't give like really specific responses just because so many things we have to like dive in together, but I'm happy to answer all these. Essential supplies to have on hand. That's a great question. I'm actually putting together my breastfeeding registry guide right now. It's not done all the way, but if you follow me on Instagram or on my email list, you'll get that soon. But essentials, your breasts, obviously. A pump, if you're planning to pump, but even if you're not planning to pump, I would have one, because you don't want to fall into a situation where you need to pump and you have to find one at 10 o'clock at night, because that's what happened to me and it's not fun. There's a lot of good pumps out there. Spectras are always my go-to. Spectras, Baby Buddhas are good too. Silverettes, they're like silver cups, and they are amazing they're like $40, and so it's an investment, but you can use it from birth to weaning, and I have used it for all those stages. It's these little silver cups that you put on your nipples. You don't want to put nipple cream in them because that counteracts the benefits of the silver, but they are great for healing nipple damage. and for nipple pain, obviously while addressing why you're having nipple damage and nipple pain. I love like these TheraPearls. I think it's from Lancena is the brand, and there's different brands out there that you can buy as well. But I love those because they are great for clogged ducts. They're great because you can heat them up and you can have them as cold. You can freeze them, and I love, love, love those. Other essentials. I mean, there's not a lot that I'm like, you have to absolutely have this. There's things I love that I think are awesome products. But yeah, if you follow me along, I will have my breastfeeding registry guide that's coming out soon. So the part about both sides, so even out pumping with nursing. So if you are super lopsided, what you're going to want to do is to definitely prioritize that side that is a lower producer. So that's putting the baby on that breast for the beginning of each feed. If you're going to be pumping, you can do the power pumping where it's, you pump for 10 minutes on, 10 minutes off for an hour, or take a 3-hour block of time and pump for 10 minutes at the beginning of each of those hours. And so it's really just trying to increase the supply on that side. It may or may not work just depending on the reason why that supply is lower. If your baby has a preference to one side, sometimes that can be because the flow is faster. Sometimes it can be because your baby has tension. Tension is a totally underlooked reason for feeding issues, for gas issues, for latching issues, for so many issues. So tension, which can happen because of your baby's position in the womb, your birthing experience. Like if you have a C-section, sometimes the babies will be more tense. If your baby was born super fast or they were in the birth canal for a really long time, that can cause tension as well. I love Medihoney. It's a great tool. For those that aren't familiar with that, it is, I think it's like Dysport or something. I don't know the exact terms, but it's safe to use on your nipples, even though it's honey. And it's just great for, it's like, it's a wound healing tool that you could use. And so I love it. That's definitely on my list of things that you can use. I like it more than like traditional nipple cream. I'm not a huge fan of nipple cream just because like if you're just using it because it feels nice, that's fine. But I find like if we're constantly dipping our fingers into it and then putting it onto an open wound, that's just bringing bacteria back and forth. And so it's not my favorite. I think breast milk is one of your best tools. Just hand expressing a little breast milk onto your nipples. That's a great healing tool. Let's see, I'm expecting my first baby in December. I am receiving conflicting information on whether breastfeeding will hurt or be painful. What is your position? Oh, I am so glad that you asked this because I'm super passionate about this question. Because I'm sure you're on Instagram where you will see plenty of people saying, anybody who says breastfeeding doesn't hurt doesn't know what they're talking about because it does hurt and you just have to get through it. And then there's people that are like, it should never hurt. If it hurts, you're doing something wrong. And I will say that breastfeeding should not hurt if it's going well. And I will go to my grave saying that if a baby is latched well, it should not hurt. There's definitely a period of time where you might feel the tugging sensation or you're like, oh, this feels different. But if you are in pain, you are like curling your toes, trying not to scream, especially if you have damage, there is a reason for that. And you do not have to wait any period of time to get help, because I have moms in my office all the time that we fix the latch and they are pain-free. And I'm like, you would have just gone for the next 3 weeks thinking that you had to go through this pain and you didn't. And so I would say if you are having pain, find someone that's going to help you figure out what that pain is. We can't always fix the pain immediately. Sometimes there are more issues like a tongue tie, or we need to work on the baby's oral function. But I will never say just suffer through being in pain. And I know I sound like I'm like lecturing people, but I feel very strongly about this because it kills me when I'm working with a mom who's like, I was just told it was supposed to be painful and I am miserable right now. And then we fix the issue and she is pain-free within minutes. And that doesn't always happen, but I never want someone to suffer through pain. And there is time to figure out, like, I find the people that are like, oh, it just got better. It's because their baby got better at latching and something changed that they may not have realized. Oh, yes. Okay. Yes, I will wrap up. Sorry, I just saw those. Take on virtual consults. I am a huge fan of virtual consults. I do them all the time. There are things that I like about in person where I can help to like manipulate the baby and move the baby and see the baby's mouth myself and weigh the baby. But I would say that is, I think there's a lot we can do for virtual consults. Prenatals are great. Clogged ducts, back to work, weaning, things like that. I'm a huge fan of virtual consults, especially when it's someone that knows how to do a virtual consult. Um, so I don't think I have time to jump into all of these, but you are definitely can come follow me on the Breastfeeding Mama. I have lots of great resources there. I have consults, I have classes, and any of you that are participating, you can get $50 off my online class plus free first year, which has tons of resources. And then I have my book that they will send the link for, which is the first year of breastfeeding, which you can get for free. Um, but yeah, hopefully that this was helpful, and sorry that I went a little bit over, but if you have questions, come follow me on the Breastfeeding Mama. I would love to help you, and I'm hopefully we'll be doing more with buybuy BABY in the future. They are great and they are awesome supporters of all types of feeding, so I'm so glad to be a part of this.
Thank you so much, Katie. I think this was very informative for everybody, including myself. I've been in the business and working for buybuy BABY for 15 years, and a lot of the things that you said were brand new to me. So thank you so much for taking the time out to talk to all of us. Thank you, everybody who joined us for, like I said, our first ever virtual event. We hope to be doing these more in the future. If you do have any questions, please DM on Instagram and we will get those over to Katie to answer. And then again, be sure to follow her as well. Thank you again. We really appreciate you spending a few hours this morning on Saturday. And until next time, take care and happy feeding, guys. Thank you. Bye-bye.
Bye. Good luck, everyone.